Hi, and welcome to this video about arterial hypertension. Arterial hypertension, also known as high blood pressure, is a common condition that affects millions of people around the world. It is when the force of blood pushing against the walls of your arteries is too high. This can damage your arteries and increase your risk of heart disease, stroke, and other health problems. What is arterial hypertension? Your blood pressure is the force of blood pushing against the walls of your arteries. It is measured in two numbers, systolic blood pressure and diastolic blood pressure. Systolic blood pressure is the pressure when your heart beats. Diastolic blood pressure is the pressure when your heart is at rest. Arterial hypertension is when your blood pressure is consistently high. High blood pressure is usually diagnosed when your systolic blood pressure is 140 mmHg or higher, or your diastolic blood pressure is 90 mmHg or higher. What causes arterial hypertension? The exact cause of arterial hypertension is unknown, but there are a number of factors that can contribute to it, including age. High blood pressure is more common in older adults. Family history. If you have a family history of high blood pressure, you're more likely to develop it yourself. Race. High blood pressure is more common in African Americans, Hispanics, and Native Americans. Weight. Obesity is a major risk factor for high blood pressure. Physical inactivity. People who are physically inactive are more likely to develop high blood pressure. Smoking. Smoking damages the lining of your arteries and can increase your risk of high blood pressure. Too much salt in your diet? Eating too much salt can raise your blood pressure. Too much alcohol. Drinking too much alcohol can raise your blood pressure. Certain medications. Some medications, such as steroids and birth control pills, can raise your blood pressure. What are the symptoms of arterial hypertension? Most people with high blood pressure do not have any symptoms. This is why it is important to get your blood pressure checked regularly, even if you feel fine. Some people with high blood pressure may experience symptoms such as headaches, fatigue, shortness of breath, nosebleeds, vision problems, chest pain, swelling in the hands and feet. How is arterial hypertension diagnosed? High blood pressure is diagnosed by taking your blood pressure. Your doctor will use a blood pressure cuff to measure your blood pressure in both arms. How is arterial hypertension treated? The goal of treatment for high blood pressure is to lower your blood pressure to a healthy level. This can be done with lifestyle changes and medication. Lifestyle changes that can help lower your blood pressure include losing weight if you are overweight or obese, eating a healthy diet, exercising regularly, quitting smoking, reducing your salt intake, limiting your alcohol intake. Medications that can help lower your blood pressure include beta blockers, calcium channel blockers, diuretics, ACE inhibitors, ARBs. What are the complications of arterial hypertension? If high blood pressure is not treated, it can lead to a number of serious health problems, including heart disease, stroke, kidney disease, eye problems, aneurysm, impotence, premature death. How can I prevent arterial hypertension? There is no sure way to prevent high blood pressure, but there are a number of things you can do to lower your risk, including maintaining a healthy weight, eating a healthy diet, exercising regularly, quitting smoking, reducing your salt intake, limiting your alcohol intake, getting regular checkups and having your blood pressure checked. Conclusion: arterial hypertension is a common condition that affects millions of people around the world. It is important to get your blood pressure checked regularly, even if you feel fine. If you have high blood pressure, there are a number of things you can do to lower your risk of developing serious health problems. By making lifestyle changes and taking medication, you can control your blood pressure and live a long and healthy life. Thank you for watching this video about arterial hypertension. I hope you found it informative and helpful. If you have any questions, please feel free to ask your doctor or other healthcare provider.